Hello, hello. It's Tuesday. It's noon. Today, Hil Moss is joining me. The more I hear about this woman and talk to her, the more I want to force her to become my virtual friend. Oh, she's already here. Awesome. Um, let's see. I struggle with this every week. Here we go. I think it's going to work. Hello.
Hello, my virtual friend.
Yes, I was just like, like we did an event where you were a speaker, and then we've done a clubhouse thing together, and I'm obviously following you on Instagram, and I'm like, we have these like weird overlaps of things
I
in
know.
common.
It's very bizarre. The like arts background, some interests.
Yeah,
We
totally.
are
So I'm excited to
destined to
hear
be friends.
more about you. The clubhouse thing, which I know some people aren't on Clubhouse, and I'm starting to. Clubhouse and TikTok feel like the Wild West to me of social
I
media.
know.
Like I'm tired. I'll get there, but like I'm on a really slow boat to get it. So that was cool, but I felt like there was just like so much other stuff to talk about. So I'm excited to kind of dive into who is Hil and really focus on you.
No, I love that, and thank you so much for having me.
Yeah, totally. I'm a little low energy. I'm sitting down. I had my first COVID vaccine. I'm
Oh,
drinking the champagne of hydration
oh,
as a treat
Mazel
to myself,
tov.
but I feel really like, oh, so sorry.
Yeah. No, please. Which one did you get?
I got the Pfizer.
Good. All right. Well, that is a big step. That's awesome.
Yeah, oh my God, I can't wait to like go around and hug everybody. But I'm
I
like,
know, right? Just like breathe in their face.
yes. So anyway, without further ado, do you want to do a quick intro? And that means however you want to give it. It doesn't have to be your breast cancer stats. It can just be like who you are and what you do. However you want to do it is awesome.
Yeah, sure. So I am Hil Moss. I am a breast cancer survivor. I was diagnosed when I was 28, and actually had spent many years working in arts and entertainment. And upon getting really engaged in the cancer community during the time that I was in treatment, eventually pivoted my whole focus to be on entrepreneurship and innovation in cancer care. And so I am currently a graduate student. I'm an MBA, MPH in business school and public health school, kind of enjoying being back virtually in the classroom. And I consult with companies on patient-centered innovation, helping them engage patients in new ways. So it has been a complete I mean, I literally used to work with museums and theaters. It was a completely different world, and I know you're from that world as well. But it
Totally.
has just been a pleasure to be able to work in this space now.
Yeah, I'm so excited that you're doing it. And I think it's really encouraging as someone who is nearing in on 40 and didn't really feel like I had the option to go back to school. Like
Mm-hmm.
that there are programs about entrepreneurship and innovating in the patient space. Like there's just infinity room to make it better. And it's
Yeah,
great that there are people who are working tirelessly to make it that way because
totally.
you've consumed healthcare. It's like you meet a few great doctors, you have amazing nurses, like there's individual people who are completely amazing, but the actual experience itself is
Right.
like,
Exactly. The highs can be so high. And look, you just got the Pfizer vaccine, right? Like the science is absolutely incredible. But I think, all of us as we go along write these little notes like, oh man, if only this had been different, or if only, my experience had been this way, maybe that would be better for the next person, I think
yeah.
is huge.
And I also, I joke all the time about my arts background because I was an art historian. I worked as a curator. I've done arts-based leadership training. Nothing at all
Cool.
that was in healthcare or that has really helped me other than coming from this culture of critique. And I think
Mm,
when you're working with creative people and you're working, it's much more collaborative, I think. Like
yep.
there's sort of an aesthetic and a vibe to working in a museum and working with artists that's really different than most other traditional work. And I
Yep.
see it as such a huge asset, even though it's like the most not helpful background probably to be someone developing a tech product. But how do you feel like your art and creative experience is like feeding your work now?
That's so interesting. I mean, yeah, I think so much of what I did was about kind of pushing organizations to make a bigger impact. So I would work with, say, museums on strategic plans, helping them to think about, okay, how do we engage new audiences? How do we make people feel like they're at home? And so, yes, the work is very different, but when it comes down to really like human-centered design and just how do you want to try and have the greatest impact you can on people's lives, I think it's relevant.
Yeah.
And yeah, I think there's also, as you said, just kind of the spirit of creativity. I mean, I'm not no longer working professionally in the arts, but I feel so at home in that world, right? Just
Yeah.
it's so kind of team based and it's a family. So
Yeah.
I'm
The funny thing, I
thrilled
read a
to be
book.
from it.
There was this book that I read in
Yeah.
college that was about like behavior in different architectural spaces. And I
Oh.
actually think that like the way we behave, like when you walk into a museum and when you walk into
Hmm.
a hospital, it's like the same sort of intimidating, like maybe I don't have the education to understand and consume what I'm going to see or experience. And also
Yes.
that instinct to kind of be quiet that we also have in libraries. Like it is like this human-centered design problem. Like how do we,
Hmm.
I love that you said, how do we feel at home? Like how do you feel at
Right.
home when you're looking at art that's confusing or challenging? And how do you feel at home when you're in a healthcare space and you're likely feeling really vulnerable?
Yeah. Or even, I mean, I've just been amazed. This is kind of a tangent, but it's just relevant. Like when I walk into the cancer center now, which is one of my, like, I adore Dana-Farber. I had such a wonderful experience there. I can just open the front doors of Dana-Farber and I get sick to my stomach. And it is nothing beyond like this actual instinctive
Mhm.
physical reaction that we have when we've been in a place that where you've felt a certain way and endured a certain trauma. And so, yeah, I think there are a lot of interesting questions there about, in terms of patient experience design, what needs to happen in the cancer center and what is, so essentially physical, but also what can happen through digital means. And
Yeah.
I think that actually could be really, really helpful to the patient. People think about how things like telehealth separate you from the system, but in some ways, that can actually be a good thing for your mental health.
Oh, totally.
So
Yeah,
it's
you can
interesting.
curate that experience in a really
Hmm.
meaningful and purposeful way that like you can't get around, right? Like you
Right.
could go in a different door of a building or you could end up somewhere where you're in the wrong place, but if it's a digital experience, it's like tighter.
Yeah. I remember one of my favorite anecdotes I ever heard was that the new JetBlue terminal in LaGuardia Airport, the architecture team included a choreographer, a dancer,
Oh,
to
cool.
think about how people move through space, right? So it's like
Yeah.
you can these new perspectives, they can shape things up and really make a difference.
Yeah, totally. And I think
Yeah.
the awesome thing about like that as an example is most people aren't going to know that. They're just
Right.
going to move through it and be like, I like being here. I like
Yeah.
getting from here to there. And it just speaks to like having a diversity and perspective in those things
Yeah.
that we're designing and probably why it's so helpful in your current pursuit that you have had this experience because you
Right.
can say, I've done this, I've been there, I understand this.
Totally.
So what
Totally.
kind of things are you like what do you hope once you're done with your program, like what do you want to focus on?
We'll see. So, it's been a really fun time. I think the advantage of being in school is that you get to work on a number of different projects. So, currently, everything kind of falls under the realm of patient-centered innovation. I work with Hologic, the women's health medical technology company within their breast surgery division, and we think about, the types of devices and technologies that will help push breast surgery forward. And,
Mhm.
I always try to bring that kind of overarching patient, like what does the patient journey look like? Where can we potentially address pain points that would make a difference? Working on a project totally different with a startup, building out a new digital oncology solution, which is kind of similar to what we were just discussing, right? Like what
Mhm.
can happen virtually that would actually help the survivorship experience. And also about to jump in on a project in kind of more of the genomics
Oh,
space,
cool. Yeah, so
which
much
I'm,
interesting stuff.
yeah, amped about. But like, God, the next few months, it's like reading as much as I can to try and get up to speed. Um, so yeah, we'll see. The hope is I still have a year of school and would love to graduate and potentially start a venture. I know I'll have a lot to learn from you in that regard.
I
Um,
was just like, do you want to start
yeah,
my venture?
yeah, really. Exactly. But no, I mean, it's just, God, there's just so much that is interesting in this space right now. And so I'm just trying to kind of suck up as much as I can.
Yeah,
But
it's such
yeah.
an awesome time. I just had my 8-year surgery anniversary, and when I started, thank you, brilliantly,
Yay.
like a little over 4 years ago, and we have not been like on social media that long, but when I first started being like, okay, I want to try to make something to keep myself more comfortable, it was like pre-breasties. It was really, really
Yeah.
hard to find groups of people talking about the stuff that happens once you're
Hmm.
back and trying to, like there's groups on Facebook that are
Right.
where people are like, I'm about to have surgery. What are the questions I should ask? Or who got this kind of reconstruction? Or what size should, like there's all kinds of questions and information sharing. But it was
Right.
really like, where is the space for people who have been through this and who are trying to
Right.
feel good and live their best? Hi, Alyssa.
Hi,
And
Alyssa.
and how do I understand what
Yeah.
the experience is like for other people and if they're having the same issues I'm having? And in the last 4 years, the space is like blowing up in the most
Hmm.
exciting way because most people who've been through it are like, this could be better. This could be
Right.
improved. I want to help make this better. So it's awesome that there's probably a ton of different things for you to explore and learn from, and like the wealth of people who are willing to talk about their experience, like they're just easy to access now in this awesome way.
No, it's so true. And I feel like so many of the answers really do come from those patient insights. We had this clubhouse the other night for the breasties where we were talking about surgery tips and tricks. And God, there were so many things that people said where I really wish I had known them before my mastectomy or my reconstruction, right? Like really interesting tips like, oh, take this particular type of cough drop because it will help with dryness after the anesthesia, or
Yeah.
rent a hotel room with an accessible bathtub, and then you'll be able to like walk into the shower. And it's just the more that we create these spaces to share those insights, those are the hacks that really
Yeah. They're
actually
like,
help people's day
and
to day.
yeah, and you need them like when you're going into surgery, and you need them
Yeah,
maybe 5 years from now. Like when I posted the picture, I posted of myself in the feed.
that was gorgeous. That
Well,
was a
I do
beautiful
you
post.
see that I have my drains just taped to my body? Like
Right.
I didn't know there was a thing. Like there was no beautiful robe that had pockets in it. There
Of
like
course.
I maybe 2 months after my surgery,
Hmm.
somebody from like my friend group was like, "Oh, you could have gotten a tool belt and like put your drains in a tool belt."
Yeah. Just like walk around with your
Yeah, but I was
construction
like,
tool belt on.
why is that? Why would I have to go to Home Depot to get like my post mastectomy care garments?
No, I actually spent the last 3 or 4 months on a project at school, that was basically allowing me to take one of my biggest grudges and get a team and pay attention to it, which was thinking about redesigning the surgical drain.
Yeah,
And so I was working with some folks out of the medical school, and we were just trying to think like, okay, how could this thing that causes patients so much angst be different? And it is just amazing. You chat with different individuals, the patients think it's one of the worst parts of their entire journey. And often many of the providers just aren't kind of even aware of that
yeah.
because they work. They're easy. They're like this very simple science, right? So it's like, of course, why would we need to change that? But a little thing can have a huge impact
Yeah, I
on
was
on the
talking to one of
patients.
my newer friends who didn't know me when I had surgery and saying like
Yeah.
that was one of the worst parts.
Right.
Like they would get stuck on something or like that
Oh,
pulling. And when I, to your point, that providers don't really think about it. And I loved my surgeon, my plastic surgeon, like she's a total dreamboat. I
yeah,
walked into her
same.
office to have them removed, and she was just like, "Hook." I
Yeah,
almost threw up. I'm not someone who's queasy at all, but that feeling
I
of like
know.
the whole thing unwinding and coming out was one of, I like viscerally experienced that, and I was like, "Why did that just happen?" And
Yeah,
nobody tells you about it.
exactly. I just think one of the like things that I'm very excited about recently, and I don't have a solution to this, but it's just an idea that I think about is, how can we be bringing patients and providers together in some sort of really productive way? Because I think there is so much to be done through that partnership. I think that it would be incredibly valuable, I would hope, for providers to learn more about the patient experience. And on the patient side, I have been astonished. I am so grateful for social media, right? And for these breast cancer communities, they have changed my life. I think we also really need to be careful about misinformation, and we need to
Yeah,
make sure that, the advice that's being given is, and that's where I think the providers can come in too, right? On the patient side. And I think,
Yeah.
I can see that Dr. Pellet is here, and she is such a wonderful example of someone who is pioneering in this world, but there's so much more room to bring those parties together.
Yeah. I mean, that is the only or one of the only hiccups about social media is everybody can position themselves as an expert.
Right.
And how do you sort out the information and the sharing and I don't think there's not a ton of malice, or at least I haven't experienced it, but sometimes someone who's really well-intentioned will be like, well, what about this? And I'm like, I don't know, that doesn't seem real. And so it's, I think the role that people like you can play is so critical, and like bringing all those voices together and being like, and here's how we package this and actually make the change and disseminate real helpful information. And I think doctors who are using Instagram, it's so awesome.
I know. I love it.
It's just so good. Like, it's, most of us don't know how to digest the material that they consume and have to understand, and in these little bites of it, and the way that they share is so helpful and informative. And then I also all the time will send some of my doctor friends who are on Instagram a post and be like, is this real? Is that what actually, should I have asked that question? Is that a thing?
Exactly. So I think I would love to see kind of a group of us come together, patients, providers, and just think about, how can we create these spaces where those groups would intersect? Because I can't say enough good things about this community. I mean, how would I have ever found another 28-year-old with breast cancer, right? And then through social media, you end up with a world of friends, which is just the most incredible thing. But I think we can do even more with it.
Yeah, for sure. Well, I'm so excited to see what you do.
Same.
Hope that I can someday poach you or hire you. I think, one of the things that I have really enjoyed doing in the last 4 years of Building Brilliantly is working with women who understand what it actually is to be somebody in this community, and what is the patient journey, and what is it like to be someone living with this experience. And oftentimes that means understanding like that the pace of work is really different. Like some people are still experiencing side effects and issues and have other long-term health concerns. And really, it's given me such an amazing view into survivorship from like a whole other angle. Like, what is it like to work as a survivor, and what does that mean? And anytime I can, I try to hire people who've been through it for projects, because it's like, they get it, they know who they're talking to, and also learning how to be flexible, which now we've all done because of COVID, like trying to be remote, trying to figure out how to communicate, working at weird hours if we have children because you're working around other people's schedules. Like, I would, hope that we can kind of continue to overlap and bump into each other.
I love that.
Yeah, your career pivot is so inspiring to me. It feels really like actionable in the way that is going to empower so many more people and make big institutional change, which is really, like, we can get on here and talk all day, but until the organizations and institutions are trying to make changes, it's going to be slow. So
no, thank you. And I completely agree. Where are you based? Remind me.
I'm in Providence, Rhode Island.
Okay. So we're not, at some point we'll have to make the transition from virtual friends.
I know. Have you had
IRL friends.
Vaccine yet?
Yep. I've been vaccinated. So we're all.
I'm plotting the hug tour, so you're not very far away at all. So
perfect. All right. I would love to be a stop on the hug tour.
Yeah, we'll stop. We'll hug for a while, have some lunch.
Perfect. That sounds amazing.
Well, I hope you have a great day. I appreciate you making the time. And just like for people who want to follow along and see what you're up to, is your Instagram the best place to do that?
Yep, absolutely. At Hil Moss. And
awesome.
I hope you continue to feel better after the dose.
Yeah, I'm just gonna
like all goes smoothly.
Hydrating, which
good
is, I don't know what else I can do, but that's my plan.
I feel like that's always the answer.
I know, I was gonna make that joke, but it kind of is always the answer. So absolutely. More water.
Yeah, love it. All right, my friend. Well, thank you so much for having me.
Yeah, thank you. Have an awesome day, and I'll talk to you soon.
You too.
Bye-bye.
Bye.